King Culture presents A Plan for Longevity, a health and wellness initiative for men. Why health? Why now? At King Culture, we're equipping men to become selfless leaders, and part of selfless leadership is developing a strategy that ensures not only your well-being, but the well-being of those you're responsible for.
Traditionally, men have been programmed to have that Superman complex, to where we're always being the hero, where nothing gets us down, we're always strong and we're always solid. But we know that's not always the case.
No. I'm Domonic Purviance, and on today's episode, we're talking about how to navigate the healthcare system.
I think one of the biggest deterrents is just the cost. You know, you end up in certain situations and then this isn't covered, or you got to pay more than was expected. Like, you're just in these weird spaces where you don't know the math, you don't know the numbers, you don't know to what extent you think you're covered until you get in the situation and realize something is messed up.
Navigating the healthcare system can be challenging. Today, I sat down with Joe D'Angelo from Emory Hillandale Hospital to discuss the challenges we face and some specific hacks we need as men to navigate the system to get the care we need for ourselves and those we care for. Stay tuned. The King Culture Podcast starts now. So let's get into it. So I want to welcome you to the King Culture Podcast. This is our Plan for Longevity series where we are focusing on health and wellness. I am pleased to welcome to the podcast today Mr. Joe D'Angelo, and he is the VP of Operations for Emory Hillandale. So if you would just take a moment to introduce yourself and tell us what your role is in the hospital and how did you enter into the profession?
Yeah, well, first off, thanks for having me here today. Very excited to be here. So, as you mentioned, I'm the Vice President of Operations for Emory Hillandale. And my primary responsibility is partnering with clinical and administrative teams each day to make sure that the hospital runs effectively and efficiently. So I work with individuals each day to make sure our patients receive the best care and receive quality care, but also make sure that all of our staff and our physicians have the resources they need to provide that care. I've been in healthcare for about 15 years now. I worked in all different sectors of healthcare. Started off my career in insurance, so learning a lot about healthcare insurance, how it's funded federally and statewide. Transitioned to working with the Department of Health and Human Services. Got into healthcare technology, working with quality assurance programs, really understanding how to build those programs from a state and federal level. Then I got into academic medicine. So I spent 6 years at Duke University Hospital, starting off as an engineer. From there, I was promoted to a management role where I got to lead a team of engineers really looking at data analytics and performance and process improvements. And from there, I got more into operational role. So I got an opportunity to be administrative director of all of ambulatory surgery. So I was able to lead all of the outpatient clinics for Duke University Hospital. So did that for about 3 years. And then from there, I transitioned down to Emory in Atlanta, where I've been in my current role for a little while now, and really enjoyed it. So that's kind of my background and how I got into healthcare and operations, and really looking forward to what's to come.
Right, great, thanks. So I guess a good place to start, we've spent a lot of time, a couple episodes already in our series, just really dealing with preventative things like mental health and physical fitness and nutrition. Now we're talking about if you are at a point where you actually need to get care. How do you, what do you do? What do you need to know? And where do you need to go? And so probably the best place to start, since your expertise is in hospitals, is really, it sounds like a dumb question, but like, you know, there's so many different places you can go. You can go to a primary care doctor, you can go to a clinic, you can go to urgent care, you go to the emergency room. So with all of these different options, if you actually need to get care, how do you know what place, where you should go first? And specifically, when do I know what do I get from, what kind of service do I get from a hospital,
Mhm.
and how do I know if I need to go there?
Yeah. No, so that's actually a great question. And so I want to first start off by encouraging everyone, and all men particularly, to ensure that they have a primary care provider if possible. And along with that, ensuring that you're doing your annual visits and your physicals and your checkups each year with your primary care physician. And I think that really kind of starts the foundation of
Yeah.
healthcare, and really setting a good health pattern for your lives. So primary care is kind of the baseline standard. And from there, you talked a little bit about hospitals and emergency rooms and
Urgent care.
urgent cares and things of that nature. So I think, the hospitals are really designed to provide a wide continuum of care. So hospitals provide, emergency room care, they provide inpatient treatment, they provide outpatient surgery, they provide radiology services, pharmacy services, a wide range of care. When you start talking a little bit more about your emergent care facilities, these are organizations that's really designed to provide immediate stabilization and treatment that you can't get, like maybe it's during an off hour. So maybe it's like 2 o'clock in the morning and you can't go to your primary care and you're feeling really ill, then maybe you need to go to the emergency room. And a lot of the standalone, quick access, critical care institutions are designed for individuals who may not have insurance or may not have benefits, and then they go seek treatment at these standalone urgent cares, which are similar to emergency room, but don't have the larger scale capability. So that's kind of some of the differences between the different institutions and what they're designed for.
How do I know if I'm experiencing some kind of medical conditions? How do I know I need to go to emergency room versus just wait to see your primary care doctor or specialist?
Yeah. So I look at primary care as kind of like your annual routine visits to make sure you're in good health and in good condition. These are not always emergent situations. They may be things that you're just somewhat concerned about. But if you're in excruciating pain, or you're feeling, extremely faint, or you really feel like that you have a emergent situation, I would encourage anyone to make sure that they're going to the emergency room immediately to seek care. So the difference is really kind of determining what the level of emergency is with your case and how you're feeling. So, don't delay care, first and foremost, but really if it's more routine, I would say primary care, and not emergent primary care. But if it's more emergent, I would say visit the emergency room and the hospital to really seek that higher level of care.
Now, I know we talked before. There's a tendency in certain populations to overuse the emergency room, or there is no primary care, so it's just emergency room is where you go if there's anything medically wrong with you. What are sort of the negative sides of using the emergency room as your primary, where you deal with all of your primary health issues, and not having some consistent doctor that you're seeing on a regular basis?
Yeah, so there's a lot of reasons why the emergency rooms are used in the way that you described in different communities and different populations. I think the benefits of having a primary care physician is that you have that long-standing relationship with a provider. You're getting seen on a routine basis to make sure that your health care and your health stays in line throughout the year. Whereas emergency rooms are really designed to treat situations and illnesses at that particular point. So they're stabilizing, they're providing that care, they're providing that treatment at that point in time. But pre and post care looks different, and that's why you really want to make sure that you're obtaining a primary care physician and building that relationship so your health care is optimized throughout the entire year and not just at that specific point.
Okay. That's one of the other things that I wanted to address with you is just some of the deterrents of there's some people that overuse kind of health care in
Yeah.
emergency rooms, and there's some people, particularly men, that just there's always this hesitation to go to the doctor. And there are a lot of reasons why. One is it's just sort of the feeling that we have to sort of take it on the chin and be strong and not go see a doctor whenever there's something wrong with us. But there is sort of this history of distrust of hospitals and the medical profession. Can you talk about some of those deterrents, and what would you tell a guy if he's experiencing some medical issues and he just doesn't trust the hospital? He maybe had a bad experience with his family or relative, or he just feels like he should tough it out. What would you suggest?
Yeah, so again, great questions. And I think traditionally men have been programmed to have that Superman complex, to where we're always being the hero, where nothing gets us down, where we're always strong and we're always solid. But we know that's not always the case. So I will also say that I truly understand some of the apprehensions about going to get care, and some of the societal and longstanding historical factors that's played into that mistrust. I certainly understand that. However, I do want to encourage that each person has to be an advocate and has to be responsible for his or her care. A lot of times we see individuals delay care, and that can a lot of times mean the difference between life and death. So I think all of us at some point in life has had some type of experience with a healthcare provider or a hospital or institution that hasn't been pleasant. But I think we have to understand that the continuum of care is not going to always be perfect, but it certainly saves lives. So we have to be a champion for ourselves, because we know that our health is our wealth. And we know that our families and a lot of people are dependent on us. So we have to make sure we're well first, and that should be one of our first responsibilities.
You mentioned the idea of being an advocate for your own healthcare. We've talked to a lot of physicians in preparation for this podcast series. That came up in almost every conversation. You have to be responsible for advocating for your own care. How can you be best equipped when you go see a doctor to be able to be your own advocate? What are the things that you need to know, and how do you manage the experience to make sure that you get the kind of care that you need?
So I think you really need to, first of all, not dismiss how you feel. If you notice that you're consistently feeling a certain way, make sure you're keeping track of that. Make sure you're able to, and if you need to jot it down, and make sure that you're keeping track of how you feel. So when you go to the doctor, you can say, hey, on such and such a date at such and such a time, I was feeling this way, and this has continued for 4 or 5 days. So you're really monitoring how you feel, but you're able to communicate that with the physician so he can provide you the best care. And really championing that and being an advocate of that. Asking questions. So a lot of us, when we visit hospitals or we visit physicians, we don't necessarily understand the lingo, and we've really in healthcare over the past 10 years or so really have been intentional about making sure that we communicate in the way that patients can understand us and getting rid of some of that medical jargon. So asking questions if you don't understand, and really trying to understand what your care plan may look like and how long it may be, and if you are going to be on any types of medications. And another thing I'll also encourage is making sure that you have a good understanding of your family history. Really understanding, if there was any type of chronic diseases within your family's, within their certain individuals in your family, making sure that certain individuals may have had hypertension or diabetes or just these chronic conditions. So making sure you have a good understanding of what your family history looks like.
Yeah. Um, some of the deterrents that we've heard from some of the guys we talked to about seeking treatment is just the cost,
Mm-hmm.
right?
Yeah.
I think I was sharing
Yeah.
with you earlier, I had a friend who was in the hospital. It was a dire situation.
Mm-hmm.
And when he woke up and realized that he's going to have a huge bill,
Yeah.
I mean, he left the hospital before he actually prematurely before he really got finished getting treated for what he needed to get treated for. Came out with a huge bill, thousands and thousands of dollars.
Right.
Like, what do you say to people that are afraid to go to the hospital because and then this guy had insurance, so it wasn't like an insurance issue.
Right.
Like, what do you do? What do you say to people that are just afraid that they just can't afford it?
Yeah. So we certainly have a tremendous amount of opportunity within the United States to really optimize and decrease our cost of care. I don't think that's a secret, and that's been the case for many years. When it comes to individuals fearing the cost of care, certainly understandable. However, I think you have to weigh, again, life and death, who is depending on you, what do you what do you want to be an example for? So you may have children that you're leading or in the household, and you want them to see that, hey, Dad's trying to be strong. He's trying to be a champion for his care. He's trying to be here for us. You want the pattern, the care, the type of behavior and care for your children and for others. So I would encourage others. We have a long way to go with healthcare costs and laws and rules and regulations, and I certainly don't have all the answers to that. But I would say you really have to weigh, who you're here for, and you want, and we all want to be around for our loved ones, and we all want to be around for many years. Another thing is when you get those medical bills. So there's a lot of room for error in healthcare, and that includes billing. So, really understanding what your bills look like, and making sure that they are correct, and talking with different individuals, maybe at the hospital or different institutions that can walk you through those bills and walk you through those codes and help you understand what they mean to make sure that they've captured everything correctly. So, so really being a champion for your health care and a champion for the services that you receive.
All right. I guess because you're over hospital operations, maybe you can best explain just why does it cost so much? Like, especially there's a difference in cost between if you go to emergency room, things cost 10 times, it seems like, more than if you go see a specialist or something like that. So can you just give some insight into how prices are determined and why things are so expensive?
So that's really a multifaceted there's the multifaceted question where there's a lot of reasoning behind the cost. There's different things such as legislation, insurance companies, healthcare supply cost, equipment cost in the hospital to do these different tests and procedures. Of course, compensation for individuals in the hospitals, facility costs to keep the cost of the buildings and things up. There's multiple things that go into the reasons why healthcare has become increasingly high over the years, pharma and other things. So that's really a multifaceted question, but it is a big opportunity for us to really address and really do a kind of a ground level check on how we can improve the cost of care. So that's certainly an opportunity.
Now, how do you can you describe the relationship between hospitals and insurance companies, and how does that work, and what does a potential patient need to know when they're sort of navigating hospitals and insurance companies?
So at a very basic level, a hospital is designed to provide, first of all, safe care and quality care to any patient that visits the hospital. And so when that hospital provides a certain level of service or a procedure or treatment or surgery to that patient, there could be coverage by the insurance company. So the insurance company determines what level of coverage and how much coverage they want to provide for a specific service or a treatment. And once that service is rendered by the hospital, then if covered, then the insurance company reimburses the hospital for those services. So if you're covered at 100%, and a lot of times, then you may not receive a bill. If you're covered at 80%, then the patient is responsible for that balance from the insurance company. There's a lot of different things that go into insurance, such as premiums and co-pays and specialty pays and specialty costs and things of that nature. So I think that's a whole nother discussion.
Yeah.
But at the very basic level, that's the relationships between insurance and hospitals, and sometimes it's a love-hate relationship between the two.
Yeah.
And sometimes the patient's kind of stuck in the
Yeah.
middle
Yeah.
between those two entities. But that's the basis of the relationship between the two.
I guess one of the challenges is if you're a patient, you go to the hospital, you get treatment. You're not told what things cost. You're not told what insurance is going to cover and what insurance isn't going to cover. And then you know, you either get you do your copay or whatever, and you go home, and 2 weeks later you get a bill. It's like, well, it is not, and it's all just the patient experience. It's just really all confusing. The doctor says we're going to recommend you do this. You just need to sign off on it saying it's okay. You have no idea what you're signing up for. Just what advice do you give to a patient that's, so all of this is a deterrent, right? So I don't want to go. I don't know what bill I'm going to get stuck with. How can you just be better prepared for when you're going to a hospital and you're getting treatment, just being able to navigate what's being covered and what isn't?
Yeah, no, I certainly understand. It can be a very intimidating process if you haven't been through that level of care, and even if you have, for those who've had multiple experiences with healthcare providers, it can be very intimidating and can be a very overwhelming process. However, some feedback that I would give to individuals when going through that, again, is that preparation. So whether or not you may be sick at the time, always understanding what you're covered for, always understanding what your medical history is, always understanding what your family history is, because that's going to give you the best preparation to go in and be able to communicate with your care provider. So it starts with preparation. The next thing is, again, really engaging your physician at the time of treatment to understand what's going on right now. How am I going to be treated? How does this affect my life? Does it affect my life or the way that my daily routine goes? So am I going to have to receive rehab? Am I going to have to receive therapy? What types of medications am I going to be on? These are all really questions that you should have queued up to ask your physician if you don't understand. And then from there, so post-care treatment. So a lot of times in larger hospitals and larger healthcare systems, we've implemented positions called navigators, nurse navigators and other navigators within the social work spectrum, who, if it's going to be a long continuum of care, a long care plan for a patient, these are individuals that are assigned to patients to help them navigate the healthcare system, to give them calls and say, hey, Mr. Jones, calling to remind you that you have a 10 a.m. Appointment on Thursday. This is what's going to happen at this appointment, and this is what's going to happen. So we're working in healthcare to really get these roles, such as navigators, to help navigate patients throughout the continuum of care. But the points that I mentioned earlier is really going to help you prepare to be successful and not so overwhelmed. It's always going to be a certain level of apprehension, but that will at least prepare you for your visit.
Yeah, but what I'm hearing is just there's a lot of preparation. So you just don't show up at the hospital
Yeah.
you need to
Yeah.
do some research on,
Mm.
what your symptoms
Mm-hmm.
are.
Yeah.
Do some research on what your insurance covers,
Right.
and just know that. So when treatment is being recommended, you can know how to
Mhm.
best make decisions. Um, what a So much of healthcare in America is
Mhm.
so much tied to employment,
Mhm.
and so oftentimes if you lose your job, then
Yeah. Yeah.
you have to figure out how to find some other insurance options.
Yeah.
What advice or what resources are available if you're sort of in between jobs and
Mhm.
you for whatever reason lose health insurance coverage, and you still have to get some sort of treatment? How do patients sort of navigate that?
Yeah, so I think that's another great question. And a lot of times there are unfortunate circumstances where individuals don't have that coverage from the employer. There are alternatives to having coverage. So I'll talk about a few of them. So the first is for Medicare, which is a federally funded program for individuals who are 65 old and older, that provides coverage for them regardless of income status. Medicare is also available for individuals who are deemed disabled and receive benefits from Social Security, or individuals who are suffering from end-stage renal disease. Uh, Next is Medicaid, and I'm sure a lot of our listeners have heard about Medicare and Medicaid.
Yeah.
Medicaid is more of a state-funded program for individuals who are of a certain income status and don't meet the certain threshold for certain salaries to receive regular benefits. And then there's what we call the CHIP program, which is a program specifically designed for children under 18 to provide them benefits and coverage if they don't have a traditional insurer from their employer. So those are three different programs. And then there's the healthcare marketplace, where you can obtain different types of insurance
This is from the Affordable Care Act.
This is a product of the Affordable Care Act.
Okay.
So the insurance marketplace, where you can find reduced rate insurance plans that are more affordable for individuals to then obtain and seek care. So those are a few options that we have in place for individuals who don't have that traditional coverage from an employer.
All right. That's the last question, is if you had to give any advice. A lot of our listeners are men, sort of 18 to 34, sort of navigating this, leaving their parents, getting on their own, starting their families, starting their careers. What advice would you give our audience if they desire to have better long-term health outcomes and utilizing the healthcare system? What are some basic things that they should be doing?
Yeah. So basic things would be, I call it daily maintenance. I live by the motto that your health is wealth. So making sure that you're intentional and getting that routine physical activity as much as you can each day. Eating healthy. So being intentional about choosing foods that are low in sugar, low in salts, low in carbs, and combining that with a healthy lifestyle and physical activity would be the first thing. So taking charge of your health care. Really drinking a lot of water and staying away from processed foods and carbonated drinks and things of that nature would be the first thing. And then I think I mentioned earlier, not being afraid to establish that care with a physician. So even when you're young and you're feeling the best and feeling like Superman, establishing that care so that you're starting to build that medical documentation and medical history, and not being afraid to say that you don't feel good or you don't feel right or you're in pain, and not delaying care, and really going to seek treatment when needed. But also encouraging other young men,
Yeah.
encouraging other men to step out and to be an advocate for themselves, because you have to remember at the end of the day, someone is always depending on us.
Yes.
In some capacity, someone is always looking to us. So we have to make sure that we're in the best possible condition that we can be in at that time. And that's a responsibility for all of us. So those are a few things that I think that that every young man can do and begin to champion at a young age. So you're building that healthy pattern as you get older, and really monitoring your care and really taking charge of who you are as an individual. So those are a few things that I think every young man can do.
Thank you. I appreciate it. It's been great.
Thank you so much. Thank you for having me too.
Thanks for listening to this edition of the King Culture Podcast. For more information on a plan for longevity, visit us online at kingculture.org and fill out your personal health inventory. Follow us on social media at King Culture Inc. And don't forget to like, comment, and subscribe.